Good morning, guys. Welcome back to my channel Study with Nalini. Today's vlog is about my day in a life of a clinical analyst and the clinical research and all about my workplace. So let's get into a video. My day starts with a morning study session which I have been planned yesterday night about which topics I need to revise, which topic I need to start, and I'll plan my entire day schedule yesterday night only because it helped me to reduce my anxiety and go on everything on time. One of the best name which I can give is discipline. Discipline makes you very perfect. Anyway, I want to say about the topic which I'm going to study. As a being a family graduate, I'm really preparing for higher studies. So I need to prepare for the entrances and different kinds of entrances I'm preparing. Actually, usually before what happens, you should give only IELTS exam for a foreign country education. But now for a particular subject, they are taking an interview also within an entrance score. So I'm preparing for the both. Furthermore, I want to say about the topics which I am preparing and how I am dividing my time. Usually, I'll wake up around 4 o'clock. I'll do my morning puja rituals. I'll complete it by 6. Then at the 6 o'clock, I'll start my study section. 1 hour I'll study an IELTS preparation, and I'll take half an hour break. And again 1 hour I'll start the entrance preparation of universities which they have given particular topic. So I'll decide and revise based on this timings. Otherwise, I'll end up struggling within both of them, which has happened me in before my past days. So I decided and planned properly my schedule. Initially it was hard, but I developed a few study techniques which helped me a lot. Then I'll start preparing for my work which I need to be gone at time. Once I got ready, I just made on a short video how I'm going to look. Sorry guys, I can't reveal my face due to some situations. Once I reach my workplace, I'll check the data which I left on Saturday, how much I have completed, how much I need to go through. Once everything I'll revise, then I also find the information which I need for my research project day by day, because we can't keep pending by every day. At the end of the day, end of the weekend, it will be a very burden and heavy, which will be very difficult to me to handle. And anyway guys, the research project is about the patient care and treatment issue complications. Soon after that, I got a call for a fundoscopy test which I need to do for a diabetic patient. Here I am in a fundoscopy room. This is how the fundoscopy machine looks, and the patient and me. Due to some reasons, I'm hiding the patient's privacy, which is more important. Basically, the fundoscopy test is done for a diabetic patient who have a prolonged history of diabetes and also a retina problem for prolonged years. Now I'm going to explain how this fundoscopy machine works and what are the results and how it is going to impact onto a diabetic patient who ignores this. Fundoscopy test starts with a registration of the patient's details within a particular type of diabetes with their age criteria and the current medications. So once done with everything, I'll check whether they need a dilation or no, because dilation process is the most important process, because few people will have a large pupils and few people will have a small pupils based on their age criteria. So first I need to check that if it is large pupils, I don't need to put any dilation liquid. If it is small, I need to put a dilation liquid for 20 minutes, then I need to go for a test. So for this patient, there is no need of a dilation. His pupils were very big, so I started screening about it. And while screening, the patient cooperation is most important, and my main job role is I need to talk to the patient and make him calm, and without getting anxiety, I need to provide him details how it is going to happen, what is going to happen, and whether it is painless or a painful. After that, he might be a calm, but this patient, to be honest, literally he is irritated me a lot. But anyways, these all are common in your job roles. We have to face and we have to be experienced, and these experience make you so strong. Initially it was so tough for me after taking a training for 2 to 3 months initially, and my first screening was very difficult, and patient was a geriatric patient. It took a lot of time to convince her and make her ready for a screening, and at this time I already missed so many patients on my project, but it's fine. More you get exposure, the more you get learned. Moreover, this is my one of the best motivational thoughts which I am following since from my childhood, which makes me to keep my dreams high and do a lot of hard work. And coming to the fundoscopy system process, you people might ask how the PharmD graduate can operate a fundoscopy. For this specially I took a training for 2 to 3 months and extra month, and after getting a certificate my senior doctor has hired me for this position. Otherwise we can't even involve in the fundoscopy. This is an AI technology with reporting and further treatment process. Basically, sometimes what happens if the patient didn't cooperated you properly, you can't even say a single word to them because you need to respect your patients. Rule number 1 of your profession. Usually it takes 5 to 6 minutes to complete and send for a reporting. In this case of this patient, it took a lot of time to screening because the patient was not cooperating and not listening my words. I told him to focus on one side, but he keep rotating his eyeballs. So it took me a lot of time to convince him focus on the system and take a report. So you can see in the video I can have changed many times the situations and positions and settings to concentrate, and I explained him that if you can't look it properly you can't get a report. That time he started agreeing it. Why I told him reality? Because sometimes people don't know what is the consequences when they disagree to do that. In my situation in my hospital, they will agree in front of the doctor. When it comes to the cabin, they will struggle slightly because of they might feel it may be discomfort, or they are scared of the machine. For this reason only, initially I'll talk to them very politely and explain the procedure, and I'll tell them to cooperate within a 5 to 6 minutes, then it will be over. So after that I got a good screening and I got a good reports also, but slightly I need to absorb the changes and I need to set the settings. So it took little bit slightly long, so the reason it was delayed. Usually I want to say more about the fundoscopy, how I started and what made me to join this fundoscopy, how long it was journey and how difficult it was. So let's begin the fundoscopy journey. So initially I was joined as a clinical pharmacist and a research student. I was going within many research projects and also side by side clinical pharmacist work. By one project which was successfully published, sir got impressed and he told me that you can improve your knowledge and skills also by doing this technical work. Initially I said no because I don't have any fundoscopy knowledge, sir. Then he convinced me and he made me motivated that they will provide you a training within a certified courses, then you can do it. There is not a big deal. He motivated me a lot, so I'm really thankful for my senior authorities who made me to join this, and it is very easy to use and upload the images and see the changes and also to get the reports on the time. This is one of my best journey. I can say the more you explore, the more you get experience to your workplace. And I can say you honestly guys, if God is giving you opportunity, grab it and try to experience. Either you will fail or you will pass, but at the end of the day you will learn something. If we fail in the situation, we will get to know how to improve. If we pass, we will get the happiness. We will motivate a lot to enhance our knowledge further. It is a kind of a good motivation for me, and it was success story in my life. And here is the end of the fundoscopy session. So we got finally report. So I told the patient that he might get a report within 10 to 15 minutes. So now I'll show you the images of fundoscopy, how it comes. This is one right one and one more is left one. I will review you later. Here is the end of test. Then finally moving on to the next session. Final session was checking my results in the overall week. It was literally kind of disappointment. Again I need to re-edit it and I need to send to my higher authorities. One of the biggest task and saddest task. And here is the end of my video. Thank you for watching. Please subscribe, like, share button. It will be a very helpful. See you then. Take care. Bye.